Hi everybody, thank you so much for joining us today. We are a little late. We were supposed to start at 4 o'clock, but we're a little late because we just got back home from work.
From hospital, yeah.
And it was a very busy day. I work at the stroke service at Loma Linda University Medical Center. And I was just telling Dean earlier, we had 7 cases of acute stroke at the hospital, which is really busy. 7 strokes.
But it's relevant to the subject matter today because blood pressure, which is what we're talking about, is the main contributor, the main cause, the main cause of stroke. So today we're going to talk about blood pressure. We think one of the most important topics that is usually not covered very well, or incidentally, medication is given by a physician and not followed clearly, and patients don't take it well, and the blood pressure measurement itself is chaotic.
It is chaotic.
Once every 3 months, whenever they can, and then you adjust the medication it's something that is really affecting the healthcare system as we know it.
Absolutely.
So today we'll talk about 2 things. One is the numbers that we actually operated from. What we consider to be a healthy blood pressure and not healthy has changed significantly. And that has significantly changed the landscape of healthcare.
Right.
And, yeah.
Sorry.
No, it's fine.
But the reason we're actually talking about blood pressure today is because recently, on Monday, I believe, American Heart Association and American College of Cardiology came up with a new set of guidelines of what blood pressure means and what it should be. So every year and every few years, actually this is it was quite needed. The American Heart Association or the governing bodies come up with a set of guidelines for physicians and for people to understand where they are as far as blood pressure control is concerned. And so the latest guideline was very interesting because for decades we've known that if our blood pressure is the higher number being 120/80, that's normal. Anything lower than that is normal, and as it goes up, it is high. So they actually changed the definition of blood pressure because there was a term called pre-hypertension, which means pre-high blood pressure, and they just got rid of it. So anybody who has blood pressure higher than 130/80 is defined as having high blood pressure.
In the past, it was 140. It was the higher number, which after that we said you have a high blood pressure. That number has been moved down, which has significant implications because back then 1 in 3 adults were considered to have some blood pressure. Now that has moved to 50% of the population having the diagnosis of blood pressure.
Exactly. So that means that a lot of people are now going to carry the diagnosis of blood pressure, and I think it's great.
It was necessary.
It was necessary because the damage actually starts much earlier before anyone is diagnosed with high blood pressure.
Correct. And blood pressure affects every organ. It affects the kidneys, which is one of the first places, and vice versa, because a lot of the blood pressure problems start with the kidneys. It affects every organ that has vessels, arteries and veins. Well, almost every organ has.
Yes.
And in our case, the brain is the most vascular organ by far. So we have a category of those diseases that are affected by blood pressure, such as strokes and TIAs, but dementia and Alzheimer's. We now know that underpinning even those diseases, you have blood pressure as a cause, but we wait too late.
Yeah.
We've been waiting till the blood pressures went up to 140s and 150s systolic. Systolic is the higher number, diastolic is the lower number. That's we will not go into the detail of what those each stand for, but by then there's too much damage. That's why we think it's so helpful that we are forcing people to look at their blood pressure much earlier and start making lifestyle changes, making medication changes if necessary, earlier before significant damage is done to end organs or the organ that's being affected by the blood pressure, be it eyes, whatever the organ be.
So let me tell you exactly what happens in high blood pressure, because that was actually one of the questions that somebody asked us recently. So, what is high blood pressure and what does it do to your blood vessels and why is it important? Why is it called a silent killer? And why is it associated with such high rates of heart attacks and strokes?
And why is it so silent? Yeah.
Not really silent, is it? Yeah.
No.
So what happens is, and this is in very simple terms, we have different sized vessels in our bodies, arteries. Arteries are vessels that supply blood from the heart to the rest of the organs. And there are different sizes. You have the largest one that actually start from the heart, and then it branches and branches and branches. And the walls of these arteries are composed of smooth muscles, endothelium, connective tissue. And what happens is these muscles and these connective tissues, they become very hard. So initially the blood vessel is very elastic, but then later on with the development of blood pressure, and there's so many processes that cause the hardening of blood pressure, these become very hard. And so when blood flows into these vessels, it doesn't have that room to expand, and that's why blood pressure actually it shows itself to be high. And so imagine all of these blood vessels that go into your kidneys, into your lungs, into your brain, into your heart. They become really, really hard. And some of them, the smaller ones, actually completely close down.
Correct.
And that's why you have, chest pains because of heart attack. That's why you have small vessel disease in the brain. You may not actually feel the stroke coming on. You may not feel numbness and tingling.
Yeah,
but slowly
absolutely.
and gradually, there is extensive damage to the small blood vessels of the brain.
Capillaries.
And it manifests in most prominently cognitive impairment, slowness of whether it's motor activity, picking things up and moving around. Suddenly you're very slow, or even slowing of your thought processes and of your memory.
Yeah. Bradykinesia and bradyphrenia. I love those words.
Yeah.
I wanted to say them. I've been waiting. Slowness in motion, slowness in thinking. You've seen these patients, these people, in parties in different places. They walk slower. They think slower. That's because not a big stroke or a huge vessel burst, but these smaller vessels, which are by the billions, if not more, that actually go to the cell level, they're very friable and very tenuous, and they're susceptible to blood pressure changes. So when the blood pressure goes up, they either pop or they close, and the cells that they're feeding die off. And then over time, you don't have this one-sided numbness or weakness that you see with the big strokes, but you see this generalized slowness, and that's different from anything else you see.
Exactly, and they're called silent strokes. There are such thing as silent strokes, meaning just that. You don't see prominent signs and symptoms initially. And
they're much more prevalent than anything else.
Absolutely.
After a certain age, we see it ubiquitously, universally, everywhere. But they can be avoided if we just take care of our blood pressure early on, other things as well, which we've spoken about before, diabetes, sugar, high sugar levels consistently, but especially blood pressure. But the tools we have right now are not the best, most optimal tools. This blood pressure cuff, which most people don't know how to use it, even the electronic ones, they don't use it often enough.
Well, to start from the very beginning, we're not ever told to check our blood pressures on a regular basis. We go to from appointment to appointment.
3 months in between.
3 months, not even.
Yes.
If most of us don't have any health issues, we don't go to the doctor to check our blood pressures, do we? But we may actually have high blood pressure, and it may not be even detected in the doctor's clinic appropriately.
Correct.
Or treated for that matter.
Correct.
So the most important thing to do is to take it upon ourselves as a responsibility, as early as in our 30s and 40s.
Correct.
To get into this habit of checking our blood pressure
Correct.
on a regular basis.
Exactly. Bring it to your home.
Yeah.
Check blood pressures of your family members. Blood pressure parties, maybe not. That's too much.
Well,
but check the blood pressure regularly so that you can actually then get used to it.
Yes.
Record it. I tell people, get a notebook. If you are at risk of blood pressure, you've checked it a couple times, then twice a day for a couple of weeks, record it, write it down, and take that number to the doctor so that they have a more tangible, more long-term number that they can operate from. So blood pressure is something that we wanted to talk about, not just about as far as the fact that the parameters just changed recently. The fact that you should start understanding your own blood pressure much earlier in life, because that's when you can make a difference when it comes to your organs such as kidney, liver, erectile dysfunction is one of the most common reasons for this blood pressure, and most importantly, the brain. Yes, the brain is the most important organ for those. So it's critical that we start talking about this on a regular basis. And now read the new guidelines.
Yeah, so the new guidelines, and we've actually posted a picture on our Facebook page, the table that actually shows, what is normal, what is abnormal. So the normal is 120 over 80.
Yes.
That's normal. And anything lower than that is also normal. Once it goes beyond 120, say between 120 to 129, it's the beginnings of high blood pressure. Once it reaches 130 and it's over 80, the smaller number, 130 over 80, that's high blood pressure.
Yeah.
And I know so many people who actually tend to have it. So what do you do then? Say, for example, you see that you have a high blood pressure of 130 over 80. For those who don't have high blood pressure, check it again a couple of times. Note it down on that notebook that Dean just talked about, and take that notebook with you to the doctor's clinic every single time.
And the other thing that I want to bring out is lifestyle again. I know we are hammering this over and over again. That's when lifestyle can make a difference. Yes, if you have high blood pressure and it's early on, you might need to take blood pressure medication to control it. But remember, blood pressure medications don't reverse disease. In fact, in a way, they hide it as the disease process keeps building. So in order to stop the disease process or reverse it, you have to institute lifestyle changes, which is the same thing we keep hammering in: the nutrition, exercise, stress management, sleep management, and then medication management. So that's lifestyle.
And I was so encouraged and happy to actually see this language be a part of the guideline itself. So
Absolutely.
American Heart Association has actually included that, most important thing you can do, of course, obviously, if it's uncontrolled medication, but lifestyle, diet, exercise is so important. And how could it not be important? What you put in your body determines the health of those blood vessels that we were just talking about.
Yeah, well, some of the things we're saying seems obvious. Some smart aleck, one of the talks we did said, well, this is all so obvious. Well, it is, but if it was so obvious, why is it that we're getting unhealthier and unhealthier there was a time in 1990 where only 3 states were considered obese by weight.
States,
That's just one parameter I'm going to take. Now, I think 1 state is considered not obese. Every other state has turned out in that way.
Yeah.
Diabetes is rampant. In children now, diabetes is rampant. Same thing with blood pressure at earlier and earlier age. So if it was so prevalent, the knowledge of how to avoid it, and it was obvious, and then why is it not being done? Is because the information is not being spread and promulgated in the right places, in the family, in the home, in the community.
And the number itself right now, about 46-47% of the U.S. adults have high blood pressure by this definition.
Yes.
So why is it so?
Because the clinics have not been successful. The clinics, we keep saying, the clinic and the hospital is a disease.
It's a sick care model.
Yeah. It's healthcare is in home and community. So we're going to come to you over and over again, give you specific things to do. But more important than just numbers and the study or another study is how you institute it in your life. Checking your blood pressure on a regular basis and recording it is probably the best advice we could have given in the clinic or anywhere.
Yes.
So if we have affected a few people, we've made more difference than a day of clinic work.
Absolutely, I completely agree. So I guess the message is guidelines have changed, but blood pressure hasn't changed. It's always been there. It causes a lot of damage to our brain, to our hearts, and every other organ. And we have to start early. Don't rely on your doctor to check your blood pressure at a doctor's clinic. Do it yourself. There are a lot of blood pressure monitors that you can get from any pharmacy. You can order it online as well.
Yes.
They're relatively cheap. They're affordable. Get a notebook and keep checking your blood pressure because it's a great indication of your heart and brain health.
Sure, and if you want to make sure that your blood pressure machine is valid and is truly measuring what it is supposed to, or if you've been using it for several months and now you want to make sure that it hasn't changed, go to the clinic, to your doctor's clinic, take it with you and use their machine or have them use their machine again and use your machine. See how close it is.
And usually the blood pressure
Calibrate.
monitors, yeah, exactly. The blood pressure monitors at the pharmacies, you know, those CVS and Rite Aid pharmacies, they're very good too. So your pharmacist should be able to calibrate your blood pressure monitor with theirs as well.
Yeah.
We'll take a couple of questions if you don't mind.
And one last, and it's one of the most important factors for protecting your brain.
Absolutely.
Bar none.
By far.
Absolutely.
I mean, being a stroke neurologist, I see the devastation that high blood pressure causes.
I mean, we're seeing them. I saw one in my clinic today at 40 years of age, and
Yeah.
you saw one at 29.
I
They're very
saw-
young people. I
Yeah.
mean, younger and younger.
Yeah.
And it's because out of control blood pressure and other factors as well, diabetes and cholesterol and everything else. But blood pressure is the main factor. By the way, the blood pressure can cause two kinds of strokes. The kind that actually the vessel closes because of the thickening, and the kind that actually the vessel bursts, which is called hemorrhagic. Which is
sure.
about 15%, 13 to 15% of all strokes. Yeah.
Exactly. It's just devastating. Okay, some questions?
Yes, please.
All right. This is from Nisreen Sarifi. Oh goodness, I forgot. Basically, she says that she has a history of low blood pressure, and what do we recommend? She says, "Love Team Sherzai. We love you too.
Yes.
I have a history of low blood pressure. What do you recommend?" So it depends on why you actually have low blood pressure, and there are several reasons for it. And I hope that you have discussed that with your doctor, because there is a panel of laboratory tests that your doctor can order, and then you can take care of it. So just because your blood pressure is low doesn't necessarily mean that you have to work on raising it. You have to find out why exactly it is, and there are different mechanisms of bringing it back to normal.
Absolutely.
So I suggest that you talk to your doctor and find out what's going on.
And sometimes people consider it low, but yet they're functional. They don't get lightheaded. They don't have, when they have change in position from sitting to standing, they don't get lightheaded. Then it might be normal, but you have to check with your doctor to make sure that there's no pathology underlying this.
I had another question the other day of somebody who was actually taking salt tabs, and she was consistently asking and notifying us that this whole low salt business is not really appropriate. And that may be true for a very, very, very small percentage of people, but when you look at the numbers of high blood pressure causing stroke and heart disease, the majority of people actually have high blood pressure, and that's why it's causing the problem. The low blood pressure, like we were discussing it earlier, and the low salt conditions are very esoteric, they're very specific, and they need to be worked up specifically. But I don't suggest anyone taking salt or salt tabs to raise their blood pressure without understanding, why is it that they're having low blood pressure.
Absolutely. Absolutely.
And that's basically it. I don't have any other questions, but if you do, please post them here. We will do our best to make sure we answer them on time. And we're always open to your suggestions for any kind of discussion or topic that you want us to speak about. And I just can't emphasize more on how important blood pressure management is. This is truly one of the bane of the medical problems.
I say that the day that somebody comes up with a tool that can accurately, consistently measure the blood pressure, like a watch that can accurately, I know a lot of people are claiming, but there's no data, then healthcare system has changed.
Agreed.
At that moment, healthcare system would have changed, because then you will operate and treat according to real, meaningful numbers. So again, thank you so much, and we're looking forward to seeing you again next week.
Really appreciate you joining us. Have a good day.